Good evening. Thanks everyone for coming. I know it's like Seattle. For a few of us who flew from Atlanta, other places, not an easy place to get to. So I really appreciate coming, days before our actual ASPHO meeting. So this is certainly an inaugural United States Thrombotic Microangiopathy Consortium's meeting. It's a workshop pre other national meetings. We've been doing it with other meetings, which we'll talk about it. So I'm Satheesh Chonat. I'm one of the hematologists at Emory University and Children's Healthcare of Atlanta. Like many of you, interest in TMA and take care of patients, both, and also interest from a research aspect. So I'll briefly talk about what USTMA is, and we also want to welcome people who are virtually present. Please feel free to ask us questions anytime, and we have Claire, who's actually monitoring that chat, and we can get you in to discuss with us right away, so we don't have to wait till the end of people's talk. So I'll go briefly about United States TMA. Stop me if you have any questions. Then we have two excellent case-based presentations and also kind of a management overview that hopefully it'll be interactive, because that's what we want. And then certainly we'll have some time to do some networking. So I'll talk a little bit about our current project, so that way we can help you see how we can get involved. I know we have people both from industry and also from academic institutions. And certainly it'd be great to actually give us feedback in terms of what you think about this event and also potential future events, and if this is something that people are interested in doing it going forward. All right, so how did USTMA begin? It's actually really started by two people. Spiro Catalan, who's both of them adult hematologists, Spiro and Marshall Mazeppa. Spiro is still Ohio State, Marshall is in Minnesota, hematologists who met in, this is a 10th year, and it just happened like this. I think they met once at a coffee shop during one of the meetings, national meetings at ASH, and then discussed mutual interest in TMA. This is, as you can see, just 10 years ago, in terms of what can we do and what do we do going forward. And they decided, let's start a consortium, and they end up meeting people. So the first couple of meetings, only about probably, I think, 7 or 8 people. I can't remember exactly. It's a really small group. And then now it has actually grown. Now it's a nonprofit organization. But the key point and the way they kind of formed this is that we want people to be part of this. And the idea is to collaborate, and not just collaborate amongst the academic institutions, but also collaborate with various other advocacy organizations like Answering TTP. And since we're involved in TMA as a whole, we're also obviously interested in atypical HUS and other thrombotic microangiopathy organizations. So collaborate with institutions, collaborate with other advocacy organizations, and also collaborate with industry, because we know that's industry being a key partner in moving forward, both in advancing a variety of medications, but also being involved in providing funding for future studies. At the same time, we want to create awareness. We know this is a very rare disease compared to other diseases that we deal with. Hence, it's important to continue not only just awareness, the other physicians, but also potential families and other providers across the country. Certainly also important is advocate for these rare diseases, both at the national level, with organizations such as ASPHO, because to be honest, when we reached out to ASPHO to do this, they did not really know much about TMA. So I had to actually have lengthy discussions for several weeks with ASPHO. They've been very kind enough to provide us this room to be able to realize that this is a non-profit organization, and finally that we can do something before even. The hope is that we can actually slowly incorporate this into ASPHO, then we can have a bigger participation. At the same time, research. So I think the key part of it, as we're all interested, is to see how we move these science forward, how we can take care of the patients better, how we can provide a better care for these patients, since we have new and interesting medications available for managing these patients. So as mentioned earlier, started with a really small group, 2 institutions. Now over 20 institutions are part of it, primarily adult-oriented. So this is key, is that many of these thrombotic microangiopathies, like we know, also affects children. So that's the really kind of the driving force that we want to really also bring the pediatric aspects more into it with all your participation. And the advantage of it is, since it started 10 years ago, now we have one of the largest biorepository for patients with immune TTP. It was primarily begun, and it's still patients with immune TTP and the data on immune TTP is kind of predominant, though we are working towards trying to obtain information or the biorepository, both clinical and sample biorepository for patients with other TMAs, not just immune TTP. But it's certainly probably one of the largest in the world. As you probably know, several other countries have similar repositories and database. So it's really a wealth of information that if you're participating in it, you can actually certainly ask to be part of it and ask questions, that you can get the data, that you can actually be involved in reporting or studying various aspects of the data that's been collected. Currently, I'll talk next slide about all the open studies. There's a faculty mentoring program, and I kind of mentioned this because we have several faculty, junior faculty members, and also trainees maybe listening, is that if you're interested, we can actually reach out to our organization. You have a specific project in mind, we can actually help you with that project, provide some mentorship, because we have a variety of hematologists who actually have excellent expertise in managing TMA, and also running studies, prospective and retrospective studies, so that we can help provide some mentoring program for faculty. I think we may have one or two actually in the last year or so. And being part of such a repository also helps you from academically being able to publish papers as a co-author, but also lead some of these projects. And certainly in the last few years, since we have accumulated data, there's been significant publishing had been done, and also both in abstract form and also actually papers on immune TTP primarily, like I mentioned, but more so we're hoping to see more of other TMA, especially complement-mediated TMA in the next few days. What else we can provide? So the website is really created with the help of Claire, the groups that there are. If you go to the website, it's called USTMA.org. There's several provider resources. There's patient medical cards on TTP, other TMA, atypical HUS that you can provide to patients. We have treatment guidelines, which is online with other national, international guidelines. We can talk more about it. If you have questions for free diagnostics, there is free diagnostics that we offer currently for ADAMTS13 testing. A few of us have actually recorded videos. These are especially because families, patients also can go on the website and listen to these 1-minute hematology videos that we have recorded various aspects of TMA. These are very brief, more on the layman terms that helps for patients, families to get a glimpse of what it may be. Oops, sorry. We get several questions, both from families, but also from other providers within the country and also outside the country, about how to manage this difficult patient, what you would do, both for pediatric and adult. And certainly that can help, and you can be the expert as you kind of join us. But the hope is that we can actually have a one-stop for not just providers, but also family members, especially if they're moving and they want to find another provider, that we can actually help provide that link. There's several peer support groups which are actually involved and spin-offs within the USTMA that's kind of managed by patients and families. We can go more about it during the networking event after this. So if you go on the website and under resources, this is a really modified website, looks really nice. There's a lot of provider resources which talks about the basics of immune TTP, and these are accessible to anyone. You don't need to actually register. Like I mentioned, there's a mentorship program. There's a USTMA Connect. This is an opportunity to ask questions, medical advice, expert advice that we can provide. So mortality calculator, the publication, I think just came out a few weeks or months ago. This is again adult-based. We hope that we can actually have something similar for younger age groups. And obviously you can join the consortium. So several physician or provider resources available. The big aspect of it is how it started was to collect the data, because that's the only way we can actually learn more about these patients. So initially it got started off as a retrospective registry as shown here. On the left column is retrospective, the right column is prospective. The immune TTP in adults retrospective, it's currently locked. As you can shown here, we have over 780 patient records with close to 1,500 episodes from about 10 sites. So it's a huge wealth of information that continue to get collected. But currently we have active prospective, which is immune TTP historical registry. Now, again, many of us follow patients who are 18 and older. So these registries can be even applicable to you. So it doesn't have to be an adult institution. So these information is available online. I'm not going to go to every study which is ongoing, but I do want to bring to your attention the one in red box, which is the United States TMA retrospective immune TTP for pediatrics. So this is currently live. The way this is set up, just because we all know this is a rare condition in pediatrics more so, and going through the challenges of being able to open IRB to enroll maybe one patient, especially retrospective data, we have minimized the PHR that can be collected, thereby making it IRB exempt. So it's IRB exempt from the Children's Healthcare of Atlanta. We can provide the letter as to why it's IRB exempt. Such studies have been done before within the United States and published, so it is possible to do. Having said that, we understand that certain institutions may want this to still go through the IRB to get their own IRB exemption. That's perfectly fine. And if that's the case, we can actually provide materials that may help facilitate the process to understand why this is IRB exempt. The key is to be able to, it's a REDCap-based database, which looks something like this. If you go online to USTMA.org, you can get the registry. You can participate. If you click here into the participate in the USTMA R300 study, it takes you directly into the REDCap. And you can enter the data. You can stop, go back, especially you have the code, go back and enter the data. This is, again, retrospective. The hope is that we can provide funding and learn from this and acquire funding and do this prospectively for not just immune TTP, but also for complement-mediated TMA and other TMA-related conditions. We hope that this, several of us have been taking care of patients. We hope that we can actually get a sizable number that being part of this data will certainly provide you some opportunity to come back and ask us, can we ask a specific question related to neurocognitive outcomes or cardiovascular outcomes or mortality and such. So if you participate in this study, you can certainly have access to the data that you can actually help make your own little project potentially publish. USTMA has a store, and this is no cost to you. So if you go there, order online how much cards you need, Claire will kindly send them to you. I give this to our patients. We also have it in Spanish, and helps to kind of give understanding for the patient, but also, as you know, it's a rare disease, so they can take the card to the emergency department, especially the emergency folks are not comfortable with it. There's also a treatment plan booklet that you can actually use. I think some older patients or families actually like that to understand what the numbers are doing and such. So this, I think, is my last slide. So what are we doing? So this is a similar workshop has been done. We do it yearly. ASH has been going for several years. So if you do go to ASH, I recommend that you sign up for this USTMA workshop, which happens, I think, on a Thursday night or afternoon, which is an excellent avenue to not only it's to listen to some experts, but also to collaborate. There's actually a lot of networking opportunities for people to be able to meet people from around the world, a significant amount from those who are well known in the field of TTP. But we're actually also ensuring that we actually have a good balance with other TMAs. ISTH, or International Society of Thrombosis Hemostasis, not this year, but it's been done yearly. The first year, this year, we had it at American Society of Nephrology. It was extremely well attended, as we were talking earlier. Over 100 people actually showed up. It's the first event here at ASPHO. So do like feedback in terms of what do you think this is something that we're interested in moving forward. Potentially, I do want to kind of get some idea about there is a special interest group that ASPHO has. There's several special interest groups that people are part of. And the question is there something that people are interested in to initiate, but more importantly, how do we go about sustaining it? Either have regular webinars, case presentations that we can learn each other from. Open for suggestions. Pediatric academic societies, we're going to be going to this year. The main reason being the pediatric nephrologists who follow some of the atypical HUS and other TMA patients typically attend ASN, the American Society of Nephrology, or the pediatric academic societies. Additionally, there was also a request from the emergency medicine folks, especially pediatric emergency medicine, who actually go to the PAS meeting. So that's the reason we're trying to go to gauge the interest. The key is, as mentioned earlier, to be able to collaborate with other organizations, national organizations such as ASPHO, but also to be able to ensure that we have participation from a variety of specialties, because we know some of these patients require a multidisciplinary management. Last but not least is that we have a yearly patient meeting. This is for patients. Providers are welcome to attend, or rather encouraged to attend. This is yearly. There is a small stipend for patients to be able to make it. The goal is to go around the United States. This year it's in Texas, so we encourage people, providers, and also patients to be able to come to this event. This is an exciting event. Usually happens one full day of talks on a variety of TMAs. The night before, we have a networking event for families to be able to come. It was a huge hit in 2023. And the hope is that the patients can also interact directly with each other. And we have had excellent feedback. And the registration is already open. I know that people are registering for this event. So hope that you can actually make to the patient meeting as well. With this, I'm going to stop here. If you have any questions, I'm happy to take, or if there's any online questions, and then go to our next speaker.